I am Dr. Banshi Saboo, diabetologist and endocrine physician from Ahmedabad. I am a member of Endocrine Society of India. My major interest is diabetes. As we know that in endocrinology, the majority of the patients are of diabetes, whether you talk of type 1 or type 2 diabetes. We are mainly and very actively involved in the diabetes care across the country. We run our own NGO called Diabetes Care India. I am also the secretary of Diabetes India. I am an active member of RSSDI, and this year we are going to do RSSDI 2018 at Ahmedabad, being in capacity of organizing chairman. My major focus is a clinical inertia or a therapeutic inertia in a patients of diabetes where they are going to the primary care physician. As we know that 2/3 of our diabetic patients are not achieving a target glycated hemoglobin in our country, and there are multiple real world data is there, and it is also there in UK and US in Western population too. The one of the important reason for this therapeutic or clinical inertia is they are not able to achieve this targeted glycated hemoglobin. One of the important reason is the physician is having not following the guideline properly, or they are not escalating the therapy as per requirement. There are multiple patient factors too. There are system factors also, but this is the way by which in the future, that's in next 2021 to 2022, we are going to celebrate the 100 years of birth year of Banting, who had invented the insulin therapy in the world. So in next 1000 days, our idea is that how we can improve the care of diabetic patients across the country. So one of the way by which we can do is education, education and education. It's a continuous medical education program for primary care physician and consultant physician, which are more than 50,000 across the country. And that is the target of whether you talk of Diabetes India, RSSDI or Endocrine Society of India. One other major initiative which we have taken from our NGO, from Diabetes Care India and Diabetes India, can we make India diabetes free by 2030? It means that those who are born after 2030, they should not develop diabetes in their lifetime. So can we make some changes in the environmental factor which will really make them diabetes free, those who are born after 2030. But at the same time, we also want to change some of the genetic factors like the body fat percentage. And as you know that the children born in India, they have the fat percentage is more than 40% and their low birth weight, and they are mostly not at the normal delivery, and most of the time they are delivered at the 7-month or 8-month or full term delivery or less, and that may be also one of the reasons they are highly insulin resistant from the birth. So if we start working just now for next 10 to 12 years for the pediatric population or younger age population who are going to marry after 10 years and 15 years, and if we can give them a better quality of life in terms of better nutrition, in terms of better aerobics, exercise, their muscle mass, bone mass, if everything improves, probably when they will deliver a child, we have to make the healthy mom, and when they will deliver a child, the child should be of a birth weight of around 3 or 3.2 kg or more than that, and plus the birth weight, along with that the body fat percentage should be less than 25%. That is what at present the Caucasian is having. So it means the epigenetic factors, if we change and we change the body birth weight percentage, fat percentage, I am sure probability of getting diabetes will be lesser and lesser, and this is the only way by which we can make diabetes free India by 2030. It means children born after 2030 should not develop diabetes in their lifetime. With these two visions, one, already having the diabetes, we should reduce the complication, that is the therapeutic inertia of physician, we should improve by education, and the other, we can do primary or primordial prevention for this diabetes epidemic which is happening in India. Thank you very much.